Well, hello, everybody. Jackie Paige, and we're back for another edition of Girl Talk Live, talking all things women, all things girls, and healthcare today is complicated. Let's just be real about it. It's complicated between COVID, the flu, and everything in between. It's a lot. You don't know if it's COVID. You don't know if it's the flu. You don't know if it's a common cold, and when and who you should see. So today, I really want to bring on, and her name is Dr. Stacy Ross, to talk about having a primary care physician, and if this is something that's important. Is it something that you should consider? Is it something that you should have? So we're going to dive into that today. Primary care physicians, who they are, what they do. So without further ado, let me go ahead and introduce Dr. Stacy Ross. How are you doing today?
I'm doing fine, Jackie. How are you?
I am well. Dr. Ross is a board certified family medicine specialist and director of the Family Medicine Residency program at the University of Maryland Capital Region Health Medical Group in Cheverly, MD. So let's go ahead and get right into this. What exactly is a primary care physician?
So, actually, Jackie, there are four types of primary care physicians. The first type most people are familiar with are pediatricians, and they see newborns, children, adolescents, usually up to age 18 or 21. Then there are general internal medicine doctors who see 18 and older, they see adults, and they see seniors. And then there are some obstetrician gynecologists who consider themselves to be primary care doctors. They generally see women, usually 18 and above. And then there are the family medicine doctors, of which I am. We're about, I would say, 150,000 strong in the United States. The thing that sets us apart from the other primary care doctors is that we see newborns, children, adolescents, adults, seniors in the office. We can see people in the hospital. We can deliver babies. And then, if we deliver a baby, we can take care of the mom and the newborn in the hospital. We go to nursing homes. We also sometimes go to assisted living facilities. And we can also see people in their home if they're like bedbound.
Okay, so
So we see all ages, and we see all genders. So we're very comprehensive. We can take care of the entire family. So we can have mom, dad, sister, brother, aunts,
mhm.
uncles, cousins, all of those people can come to us, and we can take care of them. And then we look at the family dynamics, which is very helpful when you're taking care of multiple people in the family.
Yeah, that definitely makes a lot of sense when you have everybody in the family.
Mhm.
Um, if there's something going on in the family, you can
Right,
pinpoint it and target it with this one person and
right.
make sure that the whole entire family is covered. Um, you know, Primary care physicians, what is the role that you all play for a family or for an individual?
So we actually give comprehensive health care. So we're there to try to prevent you from having disease, and we're also there to treat your diseases. And what happens is we're kind of that central person in the mix of doctors. So if you go to specialists, those specialists then send information back to us. We can look at, medications that the specialists have put you on to make sure that they don't interact with medications that you're currently on by other people. And so we're that central person in the mix, and we can also guide you as to where you should go if you have a particular problem, if that we can't take care of.
Mhm. Why is it important to have a primary care physician? Why can't I just go to my gynecologist and it just be her? Why do I need a primary care physician if I already have somebody else to go to?
So, say for instance, you have high blood pressure or diabetes or asthma or some kind of chronic condition, heart disease or whatever. If you're going to your OBGYN, they're not trained to take care of any of those things. So, therefore, with primary care, especially family physicians, we're trained to take care of so many things that it's just real important for us to be that doctor that knows you really well, and that when you call us, I mean, I know my patients, if you were to be my patient and you just called me on the phone, sometimes I don't even have to look in your chart. I just know you so well because I've taken care of you for so long that I can, just rattle off, probably not necessarily your medications, but at least, the problems that you might have. And then, for instance, if you were to go to the emergency room and they were to call, that person
Mhm.
is there to give them assistance as to what we've dealt with in the past, so that it just gives, like I said, it gives that compassion, comprehensive care that people really need. Yeah.
I don't know if this is something that you would be able to answer, but you just said, and this is where this question came from. You said, like, if I was your patient,
Mhm.
you have patients where you just know everything about them. Do you think, or do you feel as though people who have primary care physicians tend to fare off a little better than those who have like doctors and
Oh,
physicians kind of
absolutely.
scattered everywhere?
Absolutely. Yes. So people who just get episodic care, like they go to the urgent care or they go to the emergency room, those people don't know you. They're just treating one thing and then sending you off. Okay. But say for instance, I used to have a patient, I'm gonna give you an example. I used to have a patient a long time ago who had high blood pressure, diabetes, and he had congestive heart failure. And what would happen is every time he got a cold, he would go into heart failure. I knew that about him. So if he presented somewhere else and they, saying he has a cold, but in reality, he's in congestive heart failure, I would know that from taking care of him and would be able to alert somebody like in an emergency room.
Mhm.
No, he doesn't have a cold. He really is, you need to keep him in the hospital. So having that kind of level of knowledge about your patients, especially, and you build relationships with
Mhm.
them, and that you build relationships to the point that people invite you to events at their homes. I've had patients who have passed. I've gone to their funerals. You just get very involved with them, and you know them. You really know them.
So, question, because I have been, what happened? It may have been like it was 2 years ago at the beginning of the pandemic. I was walking my dog.
Mhm.
We were going down the stairs and he had hopped in front of me. So I fell, ended up having to go to urgent care because I
Cheverly.
sprained my ankle. And
Mhm.
one of the things that's listed on like the documents is, do you have a primary care
Yeah.
physician? I had just moved up here, so I didn't.
Mhm.
But is that one of the reasons why is that one of the reasons why that's listed so they can actually reach out? Because I just think they just want the information just to want it. Do they actually like reach out and get information?
Some they reach out, but what they want to know is, number one, who do I send this report to?
Oh.
Because the urgent care will send the report to the primary care doctor. And then they want you to follow up with the primary care doctor to make sure that whatever you had, gets better. Yeah. Hmm.
That's good to know because I never knew. And I mean, even to this day, like I still just like I leave it blank because I'm like, well, what do you need this information more?
Right.
It
Right.
makes a lot, makes a lot of sense now.
Yes.
So you talked about primary care physicians being able to treat some chronic conditions like diabetes, hypertension, asthma. What are some other things or other elements and diseases that people may have that a primary care physician can actually address?
So if we're talking about, so let's start with, say, newborns. So we will actually see newborns in the hospital, take care of any conditions that they may have. Sometimes a child may end up, being jaundiced or yellow, and we take care of that, and then we follow it up in the office. Um, so we do a lot of well child checks, sports physicals. If children get injured playing football, basketball, soccer, whatever, we can see those children. And we take care of, a lot of them have asthma, colds, flu, COVID, and all
Mhm.
that. So we take care of all those things. And then for adolescents, we see them. We deal with, we may have to deal with substance abuse with adolescents, definitely, a lot of sexually transmitted
Mhm.
infections, um, teenage pregnancy, we deal with that. Um, yeah, so, and then for adults, it runs the gamut for doing pre-op evaluations when people are going to have surgery. We know them. The surgeon says, I need to do a particular type of surgery on your patient. They come and they ask you to make sure that they'll have a good outcome from the surgery. So they make sure that you know what's going on, and that you say to the surgeon, the patient's fine, they can undergo the surgery. um, we do pap smears and contraception. We see people for anxiety, depression, bipolar, just all kinds of things. And seniors, we take care of people when they've had heart attacks and strokes, and you name it. We take
Do a
care
little
of
bit
it.
of everything.
Yes, 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 we do everything.
So this
Yeah.
is a personal question for me because I'm originally from North Carolina.
Mhm,
I live up in the DMV now, and I did slash kind of do still have a primary care physician
mhm.
back at home, but I ended up finding I have an OBGYN up here.
Right.
Um, should I should I tell my primary care physician about the doctor that I'm seeing up here and vice versa so that they can communicate? Like, what what are your thoughts on that? Because I mean, I'm thinking, okay, well, I moved from one city to the next city. They don't really need to communicate. But now that we're having this conversation, I'm thinking, you know what? And I know I'm not the only person moving around. So now
Right.
I'm thinking, I'm just like, should I have the two communicate?
So usually what we like you to do is when you're moving from one area to the next, we actually like you to get your medical records from that doctor and bring them here. And then, when we see you, then we will go through all your records. We
Mhm.
would take out, put into the medical record any problems that you had and what have you. And then we take over care from that point.
Okay.
So then that's how we do it. Yeah. And that
Okay.
and that that gives you like a seamless interaction from one doctor to the next. Yes. Hmm.
I'm a little complicated because I still will go home and see my primary care
Okay.
physician
Okay.
at home.
Okay. All right.
It just
Because
depending
you've
on
built that relationship with
yeah,
them,
yeah,
right?
yeah. To your point, I've built that relationship, and just if it falls around the time that I'm going home for the holidays, I'm like,
Yeah. Yeah.
might as,
Yeah.
might as well. But now that's really good information to know because that's something that I have not done
Hmm.
that I definitely need to do. And like I said, I know I'm not the only person who's recently moved to the area and will not be the only person moving to the area. So just wanted
Right.
to get that little bit of information out. Can my primary care physician help me develop healthy habits? We're talking a lot. We've talked a lot about the preventive care and a lot of the care that you all can help. But let's talk about some of these healthy habits as far as like eating and exercising that people need to do. Can you all help with that?
Yes, we can. So we give prescriptions for exercise. I even talk to people about sleep, because sleep is probably one of those most important things that a lot of people don't get, and it can affect a lot of other problems. We talk about um, things like uh, nutrition, of course, smoking, substance abuse. We talk about relationships that
Mhm.
people are in, because toxic relationships they can be in that affect their health. Anything that you can think of, we really, really deal with. We deal with something called social determinants of health. And what that is, do you live in a food desert? Do you live somewhere where you can't get fresh fruits and vegetables? Do you have such poverty that we give you medications and you can't get the medications? And so you're back and forth, in the hospital periodically, because you come out, you can't get the medication, you go back in. So we deal with those kinds of things. We get people hooked into social work. Sometimes we get people hooked into, some of the patients we see are homeless, and we have to get them hooked into services. So we do all of those things. So it's not just the medical part, but
Mhm.
everything that you deal with impacts the medical part. So it's what we do. So yes.
Now you
So
said
in,
you're. Go ahead.
so in terms of the healthy stuff, yes, we do all of those things too.
Now, is that something that I would need to like during my next visit? I need to say like, "Hey, I'm trying to develop these healthy habits," or after you like get my readings, would you come back and say, "Hey, this is what you need to start doing"? Like, how does that process work if I'm trying to develop healthy habits? Is it something I should ask, or are you just gonna be like, "Listen, get it together"?
Well, let's say for instance you had high blood pressure. Okay. And before giving you medication for high blood pressure, there would be a lot of things we would want to know. We want to know about your diet. Do you eat a lot of salt? Do you eat a lot of fast foods? Do you eat a lot of fruits and vegetables? Or what's your diet like? Again, we want to know what your sleep is like. We want to know, how much stress you're undergoing in terms of what you're dealing with, what you may be dealing with your family members, and that type of thing. How well do you sleep? We want to know all those things before we deal with just giving you medication because it all interacts. Yes.
How
So,
do I go about finding? Because you do a little bit of everything.
right.
How do I find somebody like a Dr. Ross who does a little bit of everything?
So we're at University of Maryland, Capital Region Health. We're in a medical group. Our number is actually on the screen, 240-677-3100. I'm in a group with about 12 other family physicians.
Mhm.
And so that's one way to get in touch with us. Yes.
Do you take referrals? Like somebody was like, "Oh, well, this is who I go to, and she do everything." Can I like slide in that way?
Yes, we do take referrals. And we also refer patients out. So if we see a patient that has something that we know is beyond our scope of practice,
Mhm.
then we will refer those patients to specialists. The thing about this, our, the thing about us referring patients to specialists is that, first of all, I know which specialist will give me a report back.
Mm.
Okay. Which is important because if you went to the specialist and then I don't hear from them, then I don't know what's happening. Okay. Secondly, I go to specialists that, I want to refer you to a specialist that I've heard good things about.
Okay.
So I used to have some specialist OBGYNs that I used to refer people to, if they needed something like a woman having, excessive vaginal bleeding and they might need to have a hysterectomy or some other kind of procedure.
Mhm.
Um, and they would go to their doctor and they would say, Dr. Ross, I just love Dr. So and so. And if two or three people came and said that to me, then I go, well, that's a great doctor. And I get reports back from them. So I'm going to keep referring people to that doctor.
Okay.
Okay. If I send somebody to a doctor who I don't get a report back, or the patient said, I don't like that person's bedside manner, or the patient's, the, the physician didn't respond to me, didn't answer my questions, that type of thing, then I go, okay, that person's off my referral list.
Mhm. No, that makes a lot of sense.
Mm-hmm.
A lot
Yeah.
of sense. What's the cost of all of this? Because gas is going up. Everything in this world is going up. Everything is so expensive. Um, is having a primary care physician a cost-effective thing? Is it something that it, any and everybody could manage?
Well, there's a saying that we would like everybody in the country to have a family physician.
Mm-hmm.
It really is, the cost of it is dependent on your insurance. I
Okay.
mean, most of the time it's most of the things that we do are paid for by insurance. If people don't have insurance, then we have to do adjustments as far as that's concerned. But it's not an extra cost to you to have a primary care doctor. It actually is more cost effective to have one because, like I said, of all the things that we do and we look at as far as a patient is concerned, and we're trying to just get you to be balanced in your life, so it's important.
So a lot of people will say like, "Oh, well, I'm not sick," or "Oh, I don't feel sick, so I don't necessarily need to have a doctor. I don't need to go see a primary care physician." What would you say to those people who are just like, I'm okay. I don't need it right now."
Well, just because you don't have any symptoms of anything doesn't mean you don't have anything.
Mm-hmm.
Okay. We call high blood pressure, for instance, the silent killer because your pressure can be in stroke range and you can have no symptoms whatsoever. So if you never went to a primary care doctor, you've never had your blood pressure checked, you wouldn't even know that you had high blood pressure. That's just one example. But, what we want to do is, um, we deal with things like obesity, just different things. Like I said, we do pap smears, we do breast exams, we send you for mammogram, we send you for scans to look at the bone density to make sure that you don't need medication for that. So we do a lot of preventive medicine. We give you a lot of immunizations because there are particular times of in your life that you should have particular immunizations.
Mm-hmm.
We do that. Um, like I said, we do a lot of contraception and everything. So we would want you to have that primary care person, especially a family medicine doctor. Um, and you don't know, you could be walking around with high cholesterol. You could be walking around with a lot of things that you just don't know that you have just because you feel fine. So, and
Yeah.
it's not necessarily that we want you not to feel fine, but we want to do some tests, know what those things are, and then treat them head on in the beginning before it becomes a problem. Yeah.
Yeah, I love that you said that. Treating it in the beginning,
Right.
preventive care,
Right.
preventing, and that's really one of the purposes of having a primary care physician and going to a primary care physician is preventative measures, so that it doesn't have to on the back end have to cost you $152 million because
Right.
you
Right.
waited until the last minute to
Right.
figure out
Right.
that something was wrong. You can get somebody's eyes on it very early on. So absolutely love that you pointed that out, because I have people that say it all the time. I don't need to go to the doctor.
Right.
I'm
Exactly.
perfectly
Exactly.
fine. Just
Exactly.
because you're fine does not mean anything.
Right. But that's the same thing that people would say about, but dentists have you come back every 6 months to just get
Mhm.
routine cleaning,
Yep.
So it's kind of the same thing for us. We'd like to, at least if you don't have any particular medical problems, we kind of like to see you about once a year, see how things are going, check your blood pressure, check different things, and just make sure everything's going really well, and that's fine. Um, like I said, to prevent things. So,
As I get older, because I know things will change, as somebody ages,
mhm.
your checkups may look a little different. So, are there certain like benchmarks or certain ages that you need to make sure, like, hey, if you haven't been to a primary care physician by this age, you need to come at this age to make sure that you're getting such and such and such checked?
Well, we really like you to start off as babies and continue on. So, for each age, we have certain things that we want to do.
Mhm.
So, in the first couple of years of life, we have we do checkups on children at particular intervals, like 2 months, 4 months, 6 months, 9 months. We have a schedule, and there are particular things we do at each visit. And we screen for things like to make sure that a child doesn't have ADHD at an early age and that type of thing, to make sure they're growing and developing well. And as time goes on, for teenagers, we have certain things that we want to make sure that they're dealing with, and that we prevent. And then when you become an adult, there are certain um, in, there's certain vaccines we want you to get. Once you turn 21, we want you to have a pap smear every 3 to 5 years, as long as they're okay. When you get to be 45, we want you to start having colon cancer screening. When you get to be 40, we want you to start having mammograms. So there are a lot of different screenings that we want you to have at particular times of your life, and those are things to keep you well, basically.
And those are screenings that you can
The
get.
insurance will pay for.
Insurance will pay for, and you can get by having a primary care physician. So instead of you bouncing from person to person, or even can you get some of these same screenings at like a urgent care?
Generally, if an urgent care is just a pure urgent care, then all they're doing is seeing you for a particular problem, and they're sending you back to your primary care doctor. So they're not really there to do that, Yeah.
Okay, so they're just there to, if I, like in my case, when I sprain my
Exactly.
ankle, we're
Yeah,
gonna check
exactly.
this out, get you good to
Exactly.
go, and then
Right.
send you home. That's good
Right.
to know.
Think of an urgent care as kind of a low level emergency room. Like a real true emergency room is for people who are having life threatening emergencies,
Hmm.
like a stroke, a heart attack. You're bleeding out, because you've been in an accident or what. That's what should go to the emergency room. Sometimes, like what you had, you would want to go to urgent care because if you go to emergency room, you're going to sit for 7 or 8 hours because the people that have true emergencies are going to be going before you.
Random question: if, let's say, and knock on wood, it doesn't happen again because I don't want it to, but if I had another sprain and I wanted to go see my primary care physician, could I come in and see you versus going to an urgent care?
Urgent care, absolutely, absolutely. So what a lot of primary care family physicians do is we put slots in our schedule every day for people who will call, because we know people will call and say, I have XYZ. You wake up in the morning, your throat is hurting, or you wake up in the morning and you're having a pain that you didn't have before, whatever, and you want somebody to see you. And the first person you should call is your primary care doctor and see if they can fit you in for that day or the next day. Yeah. Hmm. And then again, you're seeing somebody who knows you, who knows your
Yeah.
medical history and that kind of thing, who knows the medications that you're on, so that we wouldn't necessarily give you a medication that would interact with other medications. Thing about going to the emergency room and urgent care, you should go if you need to.
Mhm.
But, if you go to those places, you need to take a list of your medications, take a list of your allergies, so that they don't give you things that interact with what you're already taking.
Yeah. Um, Random question, but I'm gonna ask.
Okay.
You're not open 24 hours or on call 24 hours, are you?
So we are actually on call 24 hours.
Really?
24, 365. Yes, yes. So if and we may have people covering for us, but you can call any time of the day or night, weekends, holidays, anytime. We are always, yes, we're always available. So before you go to the emergency room or whatever, if you have a situation, you should call your doctor first. And your doctor will navigate you. If it's 2 o'clock in the morning and you wake up with, some severe chest pain or something like that, call your doctor. And if your doctors, will ask you a couple of questions and then direct you as to where you should go. Yeah.
I actually never knew that. I thought that primary care physicians after 5 o'clock, it was like, I'm done.
24/7, 365.
Wow, that is insane. I literally, like, I'm learning something new now. And
Mhm.
I'm like, all these years of like, because I've had a stomach virus before. I went to the emergency room. I sprained my ankle. Like, these are all situations that
Things
I
that we
could
can
have.
take care of. Yes,
Yeah,
we can
I
take
just
care of.
didn't, because a lot of this stuff kind of happened after hours. I
Mhm.
never thought to call my primary care physician. It was just always like, oh, we'll just handle it later, or I'll just say something the next time I come. But I didn't know that you could call.
Yeah. And what we're planning on doing in the future is possibly doing some telemedicine. We do telemedicine visits during the day, but setting up at some point in a future time to do telemedicine visits like in the evenings and on weekends and everything. So, we can actually see you
Yeah.
and talk and everything like that. So, yeah, but it's always good to call us first. Yeah.
How does the telemedicine, how do those telemedicine appointments work? Because, with the pandemic, that is something that
Right.
a lot of primary care physicians and a lot of, just doctors in general had to start doing. So how can you explain a little bit how that works?
So you can do a telemedicine visit. It can either be completely by phone, where we're just talking, or it can be where we're actually, doing a video and we're seeing each other. And a lot of times we do that maybe for follow up lab results. Like you may have come in, gotten a physical, sent you for a mammogram, what have you. And instead of having you come back to the office, to get those results, we can do a telemedicine visit. We can go through everything. We can discuss what the results meant, and give you that. Sometimes it'll be like people who have diabetes and it's pretty well controlled. We can do those kind of visits over video, and they can just be at home. And so it's very versatile. There's some things that we cannot see via telemedicine. Like if you have the stomach pain, we need to see you.
Okay.
But there are other things that we wouldn't necessarily need to see you. Maybe you have a rash. We could look at the rash, on a video, and maybe send something to the pharmacy for you. So.
Okay, that was going to be my question. Like, what are some of the things that you can and can't? Because there's always going to be a barrier to being virtual. So thank you for answering that. I was going to ask, like, what are some of the things that you can and can't do? And then also you pointed out that you can still, you can look at a rash and if need be, send a prescription over to the pharmacy. So that's also really good to know. Because again, in my head, I have to go to my primary care physician. We have to have a whole entire conversation for all of this to happen. So that's really, really good to know.
Yeah.
Yes. I am learning a lot right now that I just didn't, again, just things I never thought about, things that I don't, and maybe it's because, you think about your dentist and you think about some of your other healthcare professionals, and they kind of just stop at a certain hour. So you just kind of assume that when it comes to your primary care physician. So no, you were literally like giving me aha moments right now. Thank you.
Right. Just like this particular week, I was actually covering newborns in the hospital. And I was speaking to a mom today, and she's a brand new mom. And, she and the baby are going home. And she said, well, what will I do if I have, questions before I come in next week with the baby? I'm like, you can call us 24/7. Here's our number. Any question you have, just call us.
I mean, it's a huge sigh of relief, especially for like a new mom, or if you are sick and something's going on, to know that, hey, I'm not left out in the wilderness by myself.
Right.
Because that does, I remember when I sprained my ankle, I went to urgent care and I'm like, well, can I do this? And how, like, I'm feeling this pain, like, what should I do? And I just didn't know what to do. So I found myself going to Google, like, what does this say?
Right.
Is this what I'm supposed to do? No. So again, thank you for sharing. For anybody that's just now hopping on, if they're wondering like how they can get a primary care physician, what would be your advice as far as finding a primary care physician?
Well, I mean, one of the things they can definitely do is contact their insurance companies, because they have listings of the ones that take their insurance. But again, like for us, we're accepting new patients, so our number is 240-677-3100, and we be happy to take on people as new patients. Absolutely.
What if I go to one primary care
and
physician?
Comprehensive care.
Go ahead. I'm sorry.
No, go ahead. What you say?
What if I go to one primary care physician, I don't like them, and then I want to go to another primary care? Like, what if I want to bounce around a few times before I find the right one? Is that okay?
You can do that. Okay. Yes, you can do that, because you want to build that relationship, and you want to, basically what we want to do is we want to build long-lasting relationships. So if you go somewhere and they, you just don't feel like you and that physician really can get along, and there's somebody you understand, there's somebody who explains things to you, and you don't like what's going on, then yes, you can definitely hop around until you find that particular one that you go, this is the one, that I want to stay with. Absolutely.
Are there certain questions, if I'm like looking for a primary care physician, because I've never had one before, are there certain questions that I need to go in like prepared to ask to make sure that this person is, I don't want to say qualified, but qualified and a good physician?
Well, one of the things I would say in trying to find a good physician is, I usually tell people, one of the things you can do is ask your family and friends.
Okay.
Because that's how when I built a practice, a lot of times that's how I got patients, because they would refer their family and their friends to me, and coworkers and all kinds of folks, because they can give you real-time
Yeah.
information about that person, how they are and that type of thing. If you go into an office, a lot of times they'll give you a brochure about, what their hours are, what their after hours are, how they handle prescriptions, how they handle referrals, everything like that, and what their procedures and protocol are. Now, a lot of physicians um, are doing something called, they call it a portal.
Okay.
So, for instance, you come into the office as a new patient, we set you up with the portal, and then you can communicate with your doctor. So you can, send your doctor, you can ask questions on the portal. And it's not like, calling and then trying to get, that person on the phone, and you're trying to get them, between the patients that they're
Mhm.
seeing. And then the doctor at the end of the day can answer your whatever it is you want, you know. And then if you need a refill on a prescription, you can send it through the portal directly through the, directly to the doctor, as opposed to necessarily going through 3 or 4 people in the office. And it makes it a lot easier. So a lot of physicians, primary care physicians, and even specialists have that, option. So we have that option too. And we would love, for communication to happen that way. Then you don't have to worry about, like I said, calling and trying to get through and all that stuff.
Yeah.
Yes. And then, the other thing that we're looking into is actually having people to make their own appointments online. So you go in and you say, I need an appointment for this. And you go in, and we haven't gotten there yet, but we're looking at that technology too.
Yeah, that actually is something that I would love, because right now it's I have to pick up the phone and call. So if I could just
Mhm,
hop online real quick and be like, "Do-do-do-do-do, boop,"
mhm, mhm.
that would be great. I
Right,
absolutely love talking to you all, but sometimes life is a little busy. So
right, right, right.
hopping online would just make that so great. But it's good to hear that that's something that's forthcoming. That's something that we all can look forward to. What other resources does Capital Region Health provide in Prince George's County when it comes to primary care physicians?
So we have several family physicians, an internal medicine pediatric physician, and some internal medicine physicians. So that's what we offer for primary care doctors. And we have obstetrics and gynecology too.
Okay, and all of those we can get information either from our insurance company
Or you can go to our website.
and get all the information there. And for anybody watching, don't be afraid. Like Dr. Ross said, don't be afraid. Like pick up the phone and call if you have questions about certain things. Call and get those questions answered. So if you don't have a primary care physician, or if you're looking for one, you can make sure that you're getting the right primary care physician. You want to get somebody like Dr. Ross said that you can establish a long history with, because you want to live a long and happy life, and you want to know somebody that knows you and that has the best in mind for you. So ask those questions, pick up the phone and call.
Yes, yes.
Dr. Ross, if anybody wants to, maybe reach out to you, ask you a few questions, where can people contact you at?
So they can go through my program coordinator, and her name is June Taylor. June.taylor@umm.edu is the best way. Yes. Mhm,
That works.
mhm.
Dr. Ross, thank you so much for just taking a few seconds to chat with me and the DMV Maryland about the importance of having a primary care physician, especially now.
Mhm.
More than any other time. I mean, you should always have one, but with everything that's going on in the world, we got COVID, the flu,
Right,
stress. It's
right.
important that you have somebody that you can seek and talk to, and make sure that your health is together. So thank you so much for coming on and taking a few seconds just to kind of shed some light on something that a lot of people have questions about, but are a little afraid to ask. So, I had to bring it to the table.
Thank you, Jackie. It was a pleasure.
You are more than welcome. Again, thank you. And this has been another edition of Girl Talk Live.